I think one of the things that people don't realize is lung cancer is not just a disease of men, and I think that's kind of, unfortunately, still the misperception. I also don't think people realize what an effect it has because there's so much focus on colon cancer and breast cancer and prostate cancer, and I think people are realizing it more and more, but a lot of people don't realize that it's still the #1 cancer killer among both men and women. And for women, it actually takes the lives of more women than breast cancer and colon cancer combined, which are the next 2 most common cancer killers. And for men, we're actually finally seeing a decrease in the cancer mortality over time, and that's related to smoking cessation. For women, we're not seeing that yet. There's still, it's plateauing, but the decrease in incidence that we see in men and the decrease in cancer mortality that we're seeing is not the case in women. Things that put you at higher risk with smoking is earlier age of starting. So I think really trying to make sure young people don't pick up the smoking habit, because if you start earlier, you're more likely to develop emphysema and lung cancer. The longer duration you've smoked, and then the more cigarettes that you smoke per day. Well, the big one is secondhand smoke. So about 90% of lung cancer is related to the person smoking. But if you take the 10% of non-smokers who get lung cancer, about half of those it's related to secondhand smoke. And I don't mean just walking down the street and passing by somebody who's smoking. It's prolonged secondhand smoke. So working in a smoking environment, and fortunately with the Ohio smoking ban, that's going to be significantly improved. But for people who had to work day to day in a smoking environment, their risk is significantly increased by about 20 to 30% over just somebody who's never had any smoke exposure. And then the other big one is living with a smoker. The other 5% that have no secondhand smoke exposure, no smoke exposure, we're not really sure what all the causes are. Part of it's probably environmental. Like you hear a lot about radon. It's a little unclear what the real risk is with radon, but we do think there is a risk. Asbestos, which is kind of going away a little bit. And then family history is another big thing. So being aware of your family history, because there's people who have 3 or 4 relatives with lung cancer and they may never have smoked, but they're potentially at an increased risk. So being aware of your family health history, I think, is important as well. Recently, we've looked at a low-dose CAT scan for lung cancer screening, and as you know, the national screening study, the preliminary results just came out showing a 20% reduction in mortality, and that's the first time we've ever shown any benefit to lung cancer screening, which is very exciting because it's the #1 cancer killer. We don't have anything that's effective as far as screening. So I think lung cancer screening is going to have a role until the final results of these trials come out. It's not yet recommended by any society, and insurance companies aren't going to cover it, but hopefully in the next few years that'll be the case. Patients who have a positive attitude and have a positive outlook, they do better with cancer treatment, and that's clear.